Hi, and welcome back to my channel. I am Dr. Neher Sinam. Kasi si video sida koi chin augmentation ki matang de discuss tause. Koi na face or jaw surgery gumba face reshaping, jaw reshaping kai ngami na haini and sometimes these lower face, jaw and upper neck so surgeries or cosmetic procedures koina makan kai lege haibse am tuna name tawragadi facelift lay, thread lift lay, buccal fat removal, masseter muscle da botox kapaga facelift mohenba, bone surgery tawraga jaw pikhanba, si tumhanba by surgery, implant or by fillers, and then neck ki dazu liposuction, fat to khara koina loose tissues kitang phagatpa using threads or fat lokthokpa submandibular gland haina salivary gland am lay adu loose or gadi chonthar lay adu lokthokpa, and then koi skin lokthokpa, neck lift, platysmaplasty kind of lady, and then so multiple procedures lay lower face, jaw and chin neck mapasida to we have chin and neck. So keeping all these things aside, akoina ngasi ki videos the only chin khatang da focus tawse. So basically chin gi hairagadi procedure ahum lay amana bone da tawa surgery. Bone da tawa surgery hadi kaino saigi ze yam saigi bones akoina machine ama use tawga ka ani and lowest parts asise mamang in thokbra maning the in bra makha kha sangdohan bra or whatever akoina tawning budo possible oiragadi akoina sigi reposition tawbi and fix tawrani using akoigi titanium screws and plates. So sigumba bone cut number machine and akoina screws and plates size Manipur the labor plastic surgeons the available oi, but particularly for cosmetic procedures saigi huziki in high surgery se huziki oina di commonly performed downa de, even though adugi required skill leragazu and required instruments se lenaragazu just commonly so the downa dri high tare, but it is very much possible. Now, sigi surgery, saigi tawboze cosmetic ki natragazu for fractures or for tumors, dum tawnai by plastic surgeons. So, duna potential delay, but commonly tawnadri high tare just because adugi demand lainadri and adugi tawnaba mi lainadri mina plastic surgeons tasu asikize yam tawnadri high tare. Me I'm not aware. So as far as I know, everyday basis ta tawnaba gumba adu gumba di natte in hygienic is. Then chin implant. Chin implant has a silicone implant just like we nose implant happening. Face ki atopa parts ki implant to like a swaigi cheek bone mapaze swaigi matada thambo implant su lay rikon swaigi nose ki nakanda hap yawa implant su to nose the silicone implant hapa dumaina chin gizu implant thoi. So implants akoina manung dagi ya manung rom di chin manung rom dagi hapa zu yai natraga opan rom dali laga hapa gizu lay. Animaki advantages, disadvantages lay adu kupna plastic surgeon isaki plastic surgeon ka tanaraga kari tawraga phani karamba mongda tawsige hebdo adu khanaga tawani. Now chin implant hap is na mo kitang akoigi tumba watpa haitare natraga kitang maning rom daliba kitang hena protrude to honingba kitang mamang to honingba to have a better looking chin and jaw overall. So implant hapaga chinze augment tawbi chawthohan bi tumthohan bi. So apart from these two genioplasty ngasai bone gi surgery to haire chin implant similar. Third options in a quickest simplest option is in a filler. Chin da koigi filler kapaga kitang tumthon ba kitang chawthon ba haibatare kitang sangdohon ba sizu tawnai. Now filler gi benefits in a quick procedure oire and kasu bodies the surgery tawba kinam hapa kakpa khotpa kem tawdre. So do gizu benefit ama oire and filler gi disadvantage haigadra mi khara di advantage on the lower ye temporary oibase temporary oibase it's not particularly a disadvantage maksu natte mi khara temporarily adugi try tawning borga di aduzu advantage amani so mi khara gi na temporary oibase advantage oi mi khara gi na temporary oibase disadvantage oi then chin implant hapase safe oibra chin implant hapase easily adum tawba yai for the phazana kanagi tawdino haidu choose tawraga gyan tana tawraga di so chin implant hapase relatively simple procedure ni sida yam risk yam na soininga yam laite if it is done properly sida koina approach to choose tawraga manung rom deira mapande choose tawraga bone gi hek mathak ta layer am le periosteum adu mathak ta muscle kar le skin le ka so periosteum sida pocket ama create tawrni and sida perfect fit ama ohelaga implant se place tawgidoini and side the important nerves ke ka ju khar leiri plus akoina close tawu matam da wound do phazan heal tawba khotpa and yarigai implant ama hapani na body da anywhere implant hapadi infections it hondana khonna ba so sigum bakhar section ba tawraga otherwise compared to ngasai genioplasty to compare tawraga di it's a much simpler surgery habitari so thanks a lot for watching this video on chin augmentation and anything kangning ba hangning ba or opinion share tawning ba le ga di comments ta thambiro see you in the next video thank you bye